Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Today is the 17th of December, 2022. We've been doing these things for almost 2 years now, and I think for one of the first times in these 2 years, we have nearly uniformly good news. So we've gotten some good questions this week from Facebook questions at douglaspublichealthnetwork.org. And if you have more questions, please put them there, and we will go ahead and get to them later in the broadcast. As we always do, we start at the world level and then move down. And at the world level, the Omicron surge is passing, and the number of cases in the world is down. Although deaths are still high, the number of cases are still passing. It's not the same everywhere, though. In the US, it's mostly passed and we're going down. Europe continues to have some areas that still have a high amount of disease. And I especially look at the country of Denmark. So Denmark, a country a little bit bigger than the state of Oregon, 5.8 million people versus 4.2 million in Douglas County, has continued to have a high number of cases. Although they have a high vaccination rate, they have cases. They're mostly mild, but they continue to have high cases, and they've not seen the steep downward trend that many other places have seen. They're also seeing an increase in number of hospitalizations, so that's someplace to watch. In addition, when we look at Japan, they've had a peak. They're just now at their peak and starting to come down. But Hong Kong, which has not had a lot of cases during the whole pandemic, is starting to see a sharp spike, and they're not yet at the peak. But for the most part in the world, most places are past the peak. And in the US, we're definitely seeing that we're past the peak. So places that had a lot of disease just a month ago, like New York, Washington, D.C., Maryland, are seeing a steep downward trend. There are a couple of outliers in the US, and I'm not exactly able to understand. Miami-Dade County in southern Florida had a big peak starting in about the middle of December, and yet they're still having a high number of cases. In the states of Tennessee, Kentucky, and West Virginia are having a lot of cases, while the areas right around them are not. So there's still a few anomalies, but in most of the places in the US, we had a sharp peak, and now we're having the declining number of cases, a declining number of hospitalizations, and probably a declining number of deaths. Oregon is a little bit behind the rest of the country because we're a little bit more away from Europe and away from the East Coast. And so we hit our peak about 2 weeks ago, and we're coming down quite nicely. Our hospitalizations are coming down, but deaths remain still pretty high. In Douglas County, we hit our peak last week, and our number of cases is down. Our number of hospitalizations is down, but we're continuing to have a fair number of deaths. Almost all of these deaths are in people who are not up to date on their COVID vaccine. I mean, it's just striking when we consider among our seniors that about half are up to date. To have that number of deaths in the people who are not up to date is striking in how well the vaccines prevent hospitalization and death, and how serious this remains for those who are not yet vaccinated. A couple of things coming up. We expect to see a declining number of cases, declining hospitalizations, a declining number of deaths over the next month. The forecast is that by the middle of March, hospitalizations will be much down, and the number of cases will be much down, maybe as low as 10 or 20 cases per day in Douglas County. When that happens, this will be the first time during the entire pandemic where all of the conditions for changing things have met. One is we'll have a low number of cases. The second, we'll have a low number of hospitalizations. The third is everybody will have had a chance to have been vaccinated. And the fourth is that we do have now some effective antiviral treatments, either the injectable monoclonal antibodies like sotrovimab or the oral pills like Paxlovid or molnupiravir. So at different parts of the pandemic, we've had one or two or three of these things, but we've never had all of them. The other thing that's good is there's no variants of concern on the horizon. And so when we put all of those things together, we're really in the best place we've ever been in the pandemic since it started. And so I think we're going to start to see a relaxing of public health restrictions. And I think that's a good thing. I think that where we've already heard that they're going to be getting rid of mask mandates in workplaces and in schools, they're still going to maintain them in healthcare facilities. But that's going to make things a lot easier. I think we're going to back off on some of the other case investigation and contact tracing. And I think that's appropriate when the number of cases gets low. no variants on the horizon. Lots of vaccine out there. People have had opportunity to get vaccine and antiviral treatment. So we're really looking forward to a very nice springtime with far less restrictions and far less disease. So one of the questions that came up is, well, what about this BA2 variant? Well, the BA2 variant is like a brother to Omicron. Didn't come from Omicron, but it looks, looking at the things, like it probably came from the same place that Omicron came from, or that they were related sometime earlier in the pandemic. The BA2 doesn't seem to be any more serious than the BA1 or Omicron, but it does seem to maybe spread a little faster. It's only a couple of places in the country, in the world, where it spread, not spread very much in the US, but we are seeing an increased number of these cases in South Africa and in Denmark. South Africa has had now a very low number of cases. Denmark is still interesting because they've had a very broad peak in a lot of cases. So we're watching there, but we don't really know of anything else. There are no other variants of concern or variants of interest that are out there. There was a Cameroon variant about 9 weeks ago, but that seems to have died out. And there's no new variants out there. But we're always watching because we know that there are animal reservoirs of disease. Large cats, white-tailed deer, mice, mink, weasels, hyenas. So lots of different animals carry this. And when they carry it, they can continue to have mutations, and then it can spread back to humans. So we think this one probably came from bats and then went to humans. And we think then this went from people to mink and deer, and it could come back with a mutation. So it's something we're watching carefully. But for right now, we're not seeing a lot. And that really is a good sign. One of the other questions came up is about the masking. And as I said before, is it appears that the masking mandates for the general population schools are going to be over by the end of March. I think that's good timing. I think right now, getting rid of the mask mandates would be a little too early. We're still seeing a fair number of cases. And so I think waiting another few weeks will be great. We're still going to continue the mask mandates in healthcare facilities for a while. We have seen, especially in nursing homes, a lot of spread of disease from people who get sick, and then they bring it to the people who live in these long-term care facilities. So I think that's still appropriate at this point. Another question came up about what about these oral antiviral meds? So these oral antiviral meds were approved in the fall of last year. They were in very short supply until very recently, but I think over the last few weeks, we've had increasing supplies of both Paxlovid and molnupiravir. These are medicines that you would take right after you got diagnosed, sort of like you would take an antibiotic if you had an ear infection, Tamiflu if you had the flu, acyclovir if you had a herpes infection. And so these are things that you would take right afterwards for a short period of time to really reduce your viral load. Both seem to work pretty well. Paxlovid has lots of drug interactions, so it's a little bit harder to use. Molnupiravir may have some genetic things, so we're cautious about using this in kids and pregnant women. But both of those really have a potential for decreasing the severity of this if you happen to get it. So I can imagine a time in April or May where we're only having maybe 100 cases in a week. Of those 100 cases, many are going to be low risk, don't need anything. But for people who are older, have underlying conditions, that perhaps in those people, they would take one of those antiviral drugs. And then our hospital count, which peaked at about 40 last week, will be down to less than 5, in which case we can really put COVID in the rearview mirror and start thinking about other things. Now, all of that is predicated on the fact that no new variants develop, and there's no way to really know about these variants until to wait and see. There's a lot of work being done in these animal populations to see if there are any variants that are coming out, but so far we're not yet seeing that. There was another question about wastewater. So there's a very interesting thing that we figured out over the years, is that when you look at the sewage stuff that comes into water treatment plants, that it reflects what has happened in the community from where that sewage is collected. And so for years, what they've been looking at is that for drugs. And what they find is that when you take aspirin or ibuprofen or other kinds of illegal drugs, that people take them, they pee them out, they go into the sewage, and then you can measure in the sewage how much of that stuff is there, and they can correlate it with the amount of drugs and whatever else that people are taking. Well, people now have recognized that you can also look for genetic material in the sewage, and since we know that COVID is excreted in the poo, that it does arrive in the sewage systems, and then you can look at the sewage systems to see how much COVID RNA is there, and actually even look for variants. And so in some places that have done this very extensively, like New York City, what they found is that they found Omicron RNA in the sewage before they found it in people, suggesting that there were some people that were there, had it, who got into the sewage system, and they could tell about the Omicron variant. So they're very, very carefully looking at sewage in big cities and in places in Oregon to look about COVID, to look to see if this or new things are coming up. So that's really pretty much it. Overall, I think things are getting better worldwide. They're getting better in the state of Oregon. They're getting better in Douglas County. And so that's great. So our advice really hasn't changed very much in this time. Even if we get to a point where there's not very much disease, we're still going to recommend stay home if you're sick. And you want to stay home if you're sick because most of the outbreaks we've seen have been spread among people who go to work or go to school when they're sick. So stay home if you're sick. If you're sick and are still sick the next day, we would recommend a home test. These home tests are great. If they're negative on that day, then it's probably not COVID, and you can wait until your symptoms get better and go back to work. If, however, it is positive, then we'd ask you to stay home for at least 5 days, wait until your fever is gone, wait until your symptoms are really getting better, and then go back to work or school. We would prefer if people stayed home for 10 days, but we understand that that's not always possible. If you do go back earlier, we do recommend that you wear a mask. There are a couple of times when we really are going to be interested in watching people, and those are people when there's a case in your household or a case in other close contacts. And so, and I'm talking about really close contacts. So household where you're with people for many hours a day, maybe a sports team where you're with people many hours a day, or people who live, roommates who live in a same small room. Those are times where we've seen very high spread. So when one roommate gets it, the other roommate or the other sports team members are very likely to get it. So in those cases, we're recommending that if you're really at high likelihood of getting it, to stay home even before you have symptoms. If you're still asymptomatic in 5 days, to get a test, and then you can go back. But overall, things are looking really quite good. This is the first time, I think, during the entire pandemic that all 5 of those conditions for lack of worry are there. So keep up the good work. Douglas County has done an incredibly good job during this entire pandemic. We ask people to continue the good work, and hopefully next week we'll have even better news. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.